Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. A couple of quick announcements before I introduce our guest for today. We have our January Digital Health Symposium coming up at the end of the month, where we will be going through a review of the JP Morgan conference that was in San Francisco this past week. We also have our HitLab Innovators Summit in person in New York in May. Make sure that you scan the QR code or check the chat for tickets to that event as well. And with that, we'd like to formally introduce our guest for today, Joe Cody, who is the founder of Grain Fertility. Thank you so much for being here, Joe. Joe, as you know, we love questions here at Women's Health Tech Wednesday. So if you have any for Joe during the conversation, please use the chat feature or the Q&A, and I will make sure that we get to it. With that, thank you so much for being here.
Thank you for having me, Nina. I really appreciate the opportunity to get to tell my story and have this great conversation with you.
Absolutely. Likewise. And I think on that note, maybe we can just jump right in and have you tell our guests a little bit more about you and really what inspired you to start Grain Fertility and kind of the journey so far for you.
Yeah, I appreciate that. So, grain fertility really is something that's incredibly personal to me. So, like a lot of people, my wife and I, when we got married, we wanted to wait a little bit before we had children. I had a career in Washington, D.C., doing regulatory policy for the American College of Cardiology. And my wife is a school teacher, and we just weren't at that point yet. And then after a few years, we started trying to conceive, and we started having trouble. We were not able to have a child. And so we went to the doctors and got a diagnosis that required us to use in vitro fertilization or IVF in order to try to have a child. And that kicked off a nearly 4-year journey that necessitated us to spend over $50,000 out of pocket. We went to 2 different fertility clinics. We had 6 total cycles, 5 of which failed. And although we were successful and we're one of the lucky ones who have a 4-year-old daughter now via IVF, it was an entirely overwhelming journey for us. So we really felt ill prepared for it. We didn't really have a lot of resources or people to turn to. I didn't really see a lot of people talking about fertility journeys and the issues they had. And using my background in communications and health policy, I really wanted to try to make a change to the way that people are supported as they go through the process. And so I started to do advocacy work for Resolve, the National Fertility Association, and ended up leading their Capitol Hill lobbying days in 2020 and 2021, bring hundreds of people to Washington, D.C. Virtually because of COVID to try to advocate for expanded access to reproductive health care. And talking with these people, I realized how similar their journeys were to us. Every day, people feel overwhelmed by the process of IVF, the costs that add up, the complexity of the care that you have, and the lack of coordination that takes place. And, working in the cardiology space, I really did see how integrated healthcare teams work to treat a total patient. While in the
Right.
fertility space, there often wasn't that coordination taking place. They often take place in separate sites of care. There's no communication between your reproductive endocrinologist and other doctors that are treating you. My wife has Crohn's disease, thyroid issues, and other comorbidities that she was managing. So we were responsible for ensuring her endocrinologist or gastroenterologist or OB and others knew what was going on throughout our 4-year journey, which was an incredibly burdensome process for us. And that's where Grain Fertility came from.
That is absolutely incredible. I have so many questions I want to dive into when it comes to that's absolutely right, when it comes to your kind of policy side of the house and kind of what you've learned from there. But I like how you were kind of speaking to what you've seen just being in the cardiology space yourself and maybe some of the ways that has kind of shaped the lens for Grain Fertility. And I would love if you could also share a little bit more about, I know you've also done some work in kind of like the health IT side of the house. Has that also kind of led to any learnings that you have taken with you to Grain Fertility?
Yeah, absolutely. I think when you look at the concept of what Grain Fertility is as a care coordination and navigation service for patients and the doctors and clinics that help them have babies, I look towards what others are doing in collaborative medicine and how can we use those types of teamwork and communication to help improve patient support as they go through this process. As we learn more about fertility, we learn more about women's health, we realize that it's not actually this siloed process
Absolutely.
that's its own thing. It's actually a lot of interconnected diagnoses and comorbidities that patients have to manage. So we need to have that coordination taking place. The
Mhm.
fertility care does not happen without having your other doctors helping manage the other components of your health, because there's more evidence about inflammation and autoimmune disorders. If someone
Right.
has fertility preservation due to a cancer diagnosis and having to do chemotherapy, they're going to have fertility issues, quite possibly. There needs to be required communication with your oncology team to ensure that everything that's happening, affects that too. And, looking at the way that the cardiology teams have evolved, where you have cardiologists working side by side with other members of the cardiovascular profession. You have nurses, you have technicians, you have all these other allied health professionals that are working together as a team. You didn't
Mhm.
really see that a lot in the fertility space. You have
Right.
reproductive endocrinologists, you have your embryologists, you have nurses, you have technicians, and they're all working as a team, but they're not really doing anything outside of that small component of it. So what we really hope to be able to do is to support patients, ensuring that they have access to the information they need so they can make informed decisions. But then, two, to help give them the tools and resources and knowledge, so that way they can be the ones who are ensuring that other doctors know what's going on, and how do we kind of connect this larger, approach to a person's health. And that's kind of where the name Grain Fertility actually comes from, because so long health information has been siloed. It's very granular. It's often in its own locations. And we really wanted to be able to cultivate a more holistic view of that person's fertility care to ensure that they have the information they need, they feel supported. That in turn can lead to better outcomes.
That's incredible. And I love that for the name. I 100% resonate with really the need for this kind of interdisciplinary approach to fertility, because we see it and see how successful it is in other disciplines and other areas of medicine. And there's so much I want to dive into specifically as it relates to the work that you're doing there. But for the founders that are on the call, I have to kind of ask the big question, which is, walk us through the process of founding Grain Fertility. What were some of the early wins, the early challenges or barriers as you were kind of taking the company off of the ground?
Yeah, so I have a very non-traditional founder's background. I'm in
Love
my
it.
late 30s. I had zero intention of ever being an entrepreneur or a founder, but as I kind of alluded to, is my own fertility journey that kind of led me down this. And my wife carried around a three-ring binder, and that's how she managed all the information that we had as we went through the fertility treatment process. And she printed out what we call a fertility CV, which is essentially her updated test results, her protocol, medication, all that information. She had it readily available weekly for her appointments. That way we had information up to date, but her other doctors knew what was going on as well when she had those appointments. And we always used to joke, and this was, the on those commercials, they say, "Oh, I wish there was an app for that."
Mhm.
But back in 2017, 2018, when we were undergoing treatment, there wasn't an app for this. The binder was the solution. And so one time during the pandemic, we were sitting around having dinner, and probably sleep deprived from everything going on, having a newborn also during it. And I was talking to her about how I could not stop thinking about how hard it was for us and how there was so much we had to manage. And I wish something else was there and I should be the one to do it. And that kind of kicked off the journey of Grain Fertility. And, I think you have to have a naivety that you, you can be the one to do this, and to really create something out of nothing it's been a long journey, but you constantly have little wins and you have to focus on those. And talking with patients, you see those validations. Talking with clinics and talking with doctors, you start to see, okay, there's something there that everyone kind of understands. The process is broken and the status quo is unacceptable. So we need to figure out ways to be able to better support patients, especially when doctors are overwhelmed, they're understaffed, they're trying the best that they can, but we know burnout is an incredibly real thing in the medical profession, and we can't contribute or can't continue to contribute to that without finding solutions that really, try to help patients while addressing those root causes. So Grain fertility really stems from that. And so those conversations, continued to happen, got that validation, and just started to build, and that's for the first year. Grain fertility was really about discovery. It was talking with patients, talking with clinics, talking with people who I'd met through the fertility space and advocacy work to understand the root cause and the problems that they experience, and then try to build a solution that really kept centered on our ethos of keeping that patient in the center of the fertility treatment experience and ensuring that they're the ones who are in control of this information. And that's, where grain fertility comes from. And, I'd be lying if I say there's not ups and downs throughout that process. You get rejections from clinics, you get rejections from investors, you get people who say, I don't think this is a real problem. You get people who haven't necessarily experienced it firsthand, considering fertility is so taboo. A lot of people aren't talking about it, but 1 in 6 people will experience infertility over the course of their lifetime. So for the 40 plus people who are watching this and people who watch this afterwards, there is someone in your life right now that you love and know who is struggling with infertility. You may just not know it because they're not out and open and talking about that. And similar to the way that we approached mental health 15, 20 years ago, where we weren't talking about it as a disease, we were talking about it as a personal failure. But we realized very quickly that addressing those stigmas, being out in the open and talking about it is the only way we can make systematic change. Fertility is the same way. So that's where I really tried to take it upon myself, and I found so much encouragement from others and sharing their stories, talking about their infertility journeys, the struggles that they experienced. But more importantly, how can we try to make it a little easier for those that come after us as they go through this process?
100%. That is so powerful. Thank you for sharing that origin story with us, Joe. One of the things that you were just touching on, really speaking to the stigma, I think resonated with a lot of folks on the call, myself specifically, when we think about not just, the fertility space, but I would say just health more broadly. And I'm so kind of curious to get your thoughts on, where do you think kind of stigma plays a role around fertility treatments? Do you feel like there still is a big stigma? Because I think on one hand, historically, it has been shrouded in so much darkness, but we see things like social media and other platforms wanting to elevate it and kind of pull it out. So would love your thoughts on that, and kind of the role that you think digital health and tech can kind of play to change that narrative around stigma.
Yeah, I think that, the stigma is slowly being drawn back, but it takes time. And part of that is led by advocates who come before me, who are talking about their stories, who are going to lawmakers, who are promoting on social media, telling stories, documenting the reality of what it's like to go through infertility treatment, as you go through this process. And, I think that there's progress being made, but I think there's real concerns about everything that's happening right now. And I saw people in the chat starting to talk about, the new administration and things that have taken place. Like, for as much as we want to continue to talk about this, there is an absolute real fear from patients about being open in your story, about talking about infertility. For so long, society has really put pressure on people, but mainly women, talking about how your role and responsibility is to have children. The best thing you can do is to be a mother. So imagine if you've been taught since you were age 3 that your entire life is predicated on being a mother, and a good mother at that point, and you want nothing more than it. But then you're told that medically you can't do it without having assistance or spending tens of thousands of dollars, going through years of trauma. That's a really overwhelming experience for someone. So you can imagine how hard it is for someone to come out in the open and say, hey, this thing that we've all thought we were going to do in life, that's not possible for me without drastic medical intervention and without maxing out credit cards, without doing all of these things that patients have to do as they go through that process. So for as much as, yes, language, I think, has dictated that, fertility, there's a stigma around it, I see signs of hope. Even with, this last presidential election, we saw a real debate for the first time at a federal policy level about should IVF and other fertility services be covered. And both candidates talked about the need for that. There's at least this basic recognition that infertility is a disease. It should be appropriately treated as such, which means that it should be covered. It should be something that's accessible to all, because right now there's extreme amounts of inequity when it comes to the distribution of fertility care, because unfortunately you do have to have the economic means for the most part in order to have fertility treatment. And even if you have insurance coverage, you're still spending a lot of money out of pocket because it's
Mhm.
cost prohibitive. Medications often aren't covered as part of it. If you have to use third party reproduction in order for your journey, for insurance will not cover it. So there are real barriers to this as well that still need to be overcome. And that's why I appreciate the opportunity to talk on avenues like this, because I do think it's incumbent on the industry, and this isn't just femtech and fertility companies, it's people who are involved in health need to be
Mhm.
talking about these issues and advocating, because it's good for people in order to have access to this care. We don't say that there should be restrictions on cancer treatments. There shouldn't be restrictions on mental health treatments, on diabetes management, or cardiovascular care. So why should we think these same things should happen in the fertility space or in women's health in general, which unfortunately, as we know, there's a lack of funding, there's a lack of awareness around those topics. So we really need to chip away at all this as we go through this.
Yes, 100%, Joe. That is so very, very well put, and I think resonated with myself and frankly everyone here. Can you share a little bit more around some of the barriers that you've historically seen when it comes to just access and not only getting the treatment, but kind of sticking with fertility treatments? I know you mentioned, the financial component being a huge one. Would love if you can share some of your additional thoughts from maybe your own experience, but also just what you've been hearing too during the discovery phase, and maybe kind of some areas of opportunity that you see for grain fertility to address those.
Yeah, I think there's a couple things. So one, I mean, shouldn't come to a shock a lot of people who are in this, that there's a workforce shortage in the fertility space. There's only a few thousand reproductive endocrinologists in the United States. And reproductive endocrinologists, for those that don't know, are OBGYNs, or gynecologists that have taken additional fellowships and training to be trained in reproductive medicine. So they're the ones who are actually guiding patients through the infertility treatment process. It takes years of additional experience in order to do that, because there's so much specificity that's required in this. So one, there's an access problem. Two, because there's so few doctors that are trained in this, there's only 450 or so SART, which is Society for Assisted Reproductive Technology, accredited clinics in the United States. So
Mhm.
think about the entire width of the United States, and those clinics tend to be concentrated in certain areas. They're going to be on the coasts, they're going to be in large cities that have populations, but they're also around states and areas that have either insurance mandates to
Mhm.
cover for it, because it's such an expensive process that if you don't have those type of mechanisms in place, a lot of your population isn't going to be able to afford it. So you have either small clinics in some of these rural places, or there's no access at all. There are patients we've worked with who have to travel multiple hours for every single component of their cycles they go through. And for those who aren't really, they don't know a lot about the fertility treatment process takes place, you have 20 to 30 appointments that take place over the course of a single IVF cycle. So that's everything from in-person testing. So you have blood testing, medication adherence, you have ultrasounds to ensure that everything's working properly. Then you have the actual milestone events such as an egg retrieval or embryo transfer, etc. So, when we look at those barriers, and those aren't even going into the financial barriers that exist and the overwhelming nature of fertility treatment, you can
Right.
see, okay, where are some exciting things that I think can take place in the next few years that can help expand access to care? And I think those are
Mhm.
concentrated around three things. One is a coming decentralization of fertility care. So historically, everything's taken place in the fertility clinic. So as I mentioned, blood draws, ultrasounds, procedures, etc. We're starting to see companies that are figuring out ways to be able to do remote monitoring for patients. Can you actually do blood work and ultrasounds in other locations and reduce the amount of time a patient has to go to one of these few centers in the United States to
Mhm.
only a few times over the course of their journey? That can save patients hours of driving, or, expenses having to travel as they go through that process, which reduces barriers to care. Two, I think automation. There are companies that are in the process of using artificial intelligence and automation in order to, uh, you know, provide additional services to patients in more equitable ways because you do have workforce shortages as you go through this. And then three is just the overwhelming nature of fertility care in general. And with one of the largest determinants, or one of the reasons that patients quit treatment is not just the financial barriers or this other stuff. It's actually just the overwhelming nature and the stress associated with fertility care. So when you look at, a dropout rate of anywhere from 20 to 60% of all fertility patients over the course of treatment, time is actually the number one determinant on whether someone can be successful. So if you have up to 7 IVF cycles, they have a pretty good probability of success of having a child, but you're asking them to commit years in order to get to that 7 cycles or whatever the number is. And some people eventually just say, I can't do this anymore, whether it's financially, but more importantly, physically. And, my wife and I, we were very close to reaching that point. Our daughter was actually our last viable embryo, and we had made the decision that we were done after this. If that last cycle did not work, we were going to quit. And it wasn't because we couldn't afford to. It was because we emotionally could not continue to have recurring failure throughout that process. We wanted to move on with our lives. We were talking about what are the ways we start to have acceptance of this, and having support and having people, going through that process would have been incredibly important to us, and my wife was going to a therapist going through this. I was involved with Resolve, so that helped, but we didn't have other people to talk to. And that's where, when I look at those key areas where Grain Fertility fits in, we really are trying to fit in that third leg, providing those patients with support, being able to connect all the different things they have to manage throughout the fertility treatment process. So that way they have a lessened cognitive burden as they go through this process, and they can really focus on what matters most, which is their mental health and their own health care.
That is incredible. And thank you for kind of really laying out not only some of the barriers that you've historically seen, but kind of the path forward. I think you've made me a little bit excited about, what all the innovation that's happening in the space, and Grain Fertility being one of them. On that note, I know you were kind of speaking to really wanting to play in the support and kind of the being able to make the interdisciplinary components of medicine a lot more kind of easier to navigate. Can you share a little bit more about kind of what that looks like for Grain Fertility? And I also see we have a question from the audience wanting to learn also a little bit more about kind of the model, the business model, kind of how you're thinking through what that looks like.
Yeah, so I think it's a really good question. I think it speaks to how Grain Fertility views the future of fertility care and the way medicine, ideally can be practiced. And so, with the patient being the center of this, if we think of like a hub and spoke type model, historically the fertility clinic has been the center of that hub, and all these different things, including the patient, are the spokes going out. So if you have a fertility patient, you go through, some of your genetic testing is done by a third party outside lab. If you're using third party reproduction, you're using a sperm or egg donation bank. Then you have also a cryo storage solution that you're going to have to require, to freeze eggs or embryos, oocytes, and have all that stuff there. You have legal considerations that you have to deal with. A lot of people have to use financing in order to pay for this. So you have financial considerations. So what Grain Fertility really hopes to be able to do is to help patients manage all of that information. Our platform is designed to be able to allow patients to centrally store all of that information in one place, easily find it, use it. And then our patient empowerment coaches are trained professionals that help people understand what all that information means in the context of their journey. So for our specific business model, we actually do this in 2 ways. One, we're working directly with fertility clinics as a way to provide additional supports on behalf of that clinic and their staff to patients. We know nurses, technicians, doctors all want to spend more time with their patients, but the unfortunate reality is there's only so many hours in a day, and it's unfortunately the way our healthcare system is set up. You have to try to maximize revenue, and right now with the fee-for-service model, that means having to have more patients coming through the doors. There's larger discussions to be had about that, but that's a different conversation probably. So to meet that reality, but still support patients, we're working with these clinics and service providers to provide additional coaching and support to their patients. So that way they know, okay, my clinic actually cares about me because they're providing this additional third-party service on behalf. And it's helping supplement the already good care that I'm getting. We're providing bespoke educational materials to those patients. But we also have a direct to consumer model because I do strongly believe that, this type of support shouldn't be tied directly to who you're getting care with. I wish we could
Right.
be in every single fertility clinic in the United States or the world, but the reality is that's not possible. And as my own story shows, we switched clinics over the course of our journey. So what
Yeah.
happens to all that information that's stored in one fertility clinic's EMR
Mm,
system? Or what happens to all that information that's kept if you move across the country or you get a new job? All this information is stored in all these different places, and that's where it goes to this idea of information being siloed and granular. Grain Fertility hopes to be able to have that information centrally located with that patient in control of it. So we do have the direct to consumer component of this also, and we always want to be able to have that as well, so those patients have information available, they control it with Grain Fertility, and then they have the ability to do whatever they want with it. Because I do fundamentally believe that patient's information is theirs and they should have control of it as they go through that process.
that's incredible. And I think on that note, Joe, when you think about, the work that you're doing and really what you're building, what are you kind of hoping or excited for when you think about, the next step or the next phase, the growth of Grain Fertility, and maybe even just the space more broadly?
Yeah, we actually just had our first member who started with us around 6 months ago, and she's pregnant. And
Oh,
that is like the
wow.
milestone that we're looking for is okay, someone came to us and they were having trouble trying to conceive. They'd had a long, difficult journey with years of difficult failures. And now they're pregnant and they're since leaving the fertility clinic to go back to their OBGYN for care and going through that. So that's the kind of stuff that we're looking for. And right now, we're really excited about the prospects of working with clinics and service providers to be able to provide that additional support and help manage these patients and really help provide that support for them as they go through that process. So those are the milestones that really make me very excited. And we have multiple patients right now who are, they're preparing for their embryo transfers or their egg retrievals. And these are the big milestone events that we prepare them for. So hopefully they do have success. And if they don't, we feel if they're adequately prepared and understand what's happening, that they'll have not only a better approach to it, but also if there is failure, they have a better understanding of why and what are ways that we continue to prepare them to eventually get to success. So that's what I'm really excited about with Grain Fertility. I really do believe that we're on the verge of being able to change the way that patients are supported as they go through the fertility treatment process. And we're looking for people to be able to partner with us as we go through this. And so if anyone is working with patients, or involved in the fertility space or has ideas on how we can better coordinate care, we're always looking for ways to be able to do that. Because I think collaboration and shared decision making is the best way for us to be able to support patients to ensure that we have good outcomes.
100%. And for everyone that's listening, Joe's LinkedIn is available in the chat as well. Joe, is there any other way that you would like folks on the call to be able to contact you, or is LinkedIn kind of the best place to start?
LinkedIn's great. I'm also incredibly active on social media. So for like Instagram and stuff under at Grain Fertility, and then also at Joe Cody 5 is my personal handle. My personal handle tends to be more advocacy focused. So if you're interested in politics and advocacy, also a complete plug for an organization that I've spent a lot of time with, Resolve, the National Fertility Association. Organizations like that are incredibly important for trying to protect access to reproductive health care. And we need the voices of industry professionals to be able to educate members of Congress and the new administration on the importance of women's health. I think it really does take a collective, it takes all of us working together in order to do that. So please reach out to me on any social media channel or LinkedIn. I would love to be able to talk and learn with anyone. I think this is a great organization, and everything that HitLab does is fantastic for the women's health community. So thank you.
Thank you so much, Joe. And I think on that note, I just looked at the time and I didn't realize that 30 minutes just flew by. We definitely need to have you again for a part two. I feel like there's so much for us to share and frankly to learn from you. Your story. Thank you so much for being so personal and vulnerable with us and kind of sharing your story and your passion. I mean, I am just fully inspired. So it's a great way to start my Wednesday here on the West Coast. So thank you so much for taking the time to chat with us today.
Of course, thank you for having me. I always appreciate it.
Thank you, Joe. Make sure you join us next time for our next Women's Health Tech Wednesdays. Wanted to give a quick shout out to our sponsors for sponsoring this incredible conversation, as well as one last huge thank you to Joe for sharing his knowledge, his insights, his words of wisdom with us. A quick reminder too that this episode will be available on HitLab social media channels as well. So if you do want to listen to it later, you will have that opportunity. Thank you all again, and we'll see you next Wednesday. Bye, everyone.